of my scientific work is the impact of the coronavirus disease 2019 on exacerbation of psoriasis. My scientific director is Professor and academician Abdrahmanov Rasim Imrahmanovich. Okay, introduction. Currently, in connection with the pandemic of a new coronavirus infection, COVID-18, an increase of the number of patients with a pronounced exacerbation of psoriasis during COVID-19 is noted. It is likely that the use of hydroxychloroquine, which is used for atypical therapy of COVID-19 in patients with mild and moderate forms, can be a trigger in the development of the exacerbation of psoriasis. It is also known that by Dr. Sacheva, she identified 18 cases of psoriasis caused by hydroxychloroquine. In 50% of cases, psoriasis was diagnosed for the first time. In 27.8%, there was an exacerbation of psoriasis in lesions. And in 22.2%, developed an episode of psoriasis recurrence after treatment with this drug. Also, a research was conducted in China by Dr. Qiang in spring. He said that outdoor activity restrictions and income loss with patient-reported outcomes of psoriasis during COVID-19 pandemic found out that 43.7% of almost 1,000 patients described moderate or significant worsening of psoriasis. Well, the aim is to present a clinical case of exacerbation of psoriasis due to a novel coronavirus infection. Methods. The method of clinical observation was used. This report describes the case of a 60-year-old patient who was admitted to the Republican Skin and Venereal Disease Dispensary in Kazan after recovery from coronavirus disease 2019. He was diagnosed with large plaque psoriasis involving palms and feet, progressive stage scalp psoriasis, nail psoriasis. Well, the results. Patient B, according to the discharge from the COVID hospital following, was prescribed hydroxychloroquine, azithromycin, and oxyparin sodium. It was noted that there was a pronounced exacerbation of psoriasis with the appearance of continuous plaques and involvement of palms for the first time. Here you can see the pictures and photos of our patient. You can see that he has a severe psoriasis on his back, on the chest, and just psoriatic papules. On the leg, you can see psoriatic plaques, and also on the elbow. Nail psoriasis. And I have to mention that he has palmar psoriasis, and it is the first time in his whole life he has this palmar psoriasis, and that happened especially after coronavirus disease. We checked his blood, and the blood test was normal. Only platelets were higher, about 534, and ACR was also higher. It is likely that changes in the blood test was associated with a past infection with COVID-19. Okay, treatment. We use different medications such as sodium thiosulfate, pyridoxine hydrochloride, methotrexate, and others. So outwardly, we use salicylic ointment, Unna cream, and betamethasone cream. And the patient underwent treatment without complications and was discharged with improvement. And the main thing I had to say is that the hydroxychloroquine has an effect on psoriasis. The possible effect of hydroxychloroquine is worsening recurrence or new onset of psoriatic lesions, and it is currently being investigated worldwide. This drug can increase the synthesis of interleukin 17, which leads to proliferate or on keratinocytes. Hydroxychloroquine causes an initial disruption of the epidermal barrier function, probably by inhibition of transglutaminase activity, followed by a psychological epidermal response to restore the barrier. This non-specific stimulus to epidermal proliferation is likely sufficient to trigger psoriasis in genetically predisposed individuals. Well, in conclusion, I have to say that we present a clinical case of psoriasis during recovery from coronavirus disease 2019. This was the first time in her medical history our patient had such a severe psoriasis. Presumably, exacerbation was provoked by hydroxychloroquine. The exacerbation of psoriasis during the pandemic outbreak of coronavirus disease can be explained by several reasons. Use of hydroxychloroquine, excessive inflammatory response, the coronavirus disease, psychological stress, anxiety, depression, decline in household income, limited outdoor activities. So hydroxychloroquine treatment of coronavirus disease 2019 may result in exacerbation of psoriasis, thereby monitoring for adverse effects of hydroxychloroquine treatment is necessary. Also, I have to say that our article was published in Kazan Medical Journal, so there you can read our full text of our article, and there is a link for citation below. You can read that. So, and thank you for your attention. Please, if you have any questions, you can ask me. Okay. I will answer. Thank you.